Good morning, Sean. Welcome to the Patient Assessment Management Trauma skill. In this skill, you will have 10 minutes to perform your assessment and voice treat all conditions and injuries discovered. You should conduct your assessment as you would in the field, including communicating with your simulated patient. You may remove the simulated patient's clothing down to her shorts or swimsuit if you feel it is necessary. As you progress through this skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection, for example, blood pressure, will be given to you only when you ask following demonstration of how you would normally obtain that information in the field. You may assume you have two partners working with you who are trained to your level of care. They will correctly perform the verbal treatments you indicate necessary. I will acknowledge your treatments and may ask for additional information if clarification is needed. Do you have any questions?
I do not.
Okay, here's your scenario. You respond to a car crash and find an ejected victim. She is laying 60 feet from the overturned car.
Okay. I'm going to get my BSI on. Is my scene safe?
Yes, it is.
Okay. My mechanism of injury or illness appears to be a victim ejected from a motor vehicle. Is this my only patient?
Yes, you only have one patient.
I'm going to request Tenepin EMS for transport. I'm going to direct one of my partners to take manual C-spine stabilization in an inline position. So if you can grab C-spine for me. Okay. My general impression is I have approximately 20 to 25-year-old female patient lying supine on the ground. She appears unresponsive at this time. I'm going to go ahead and approach my patient and check her level of responsiveness. Ma'am, can you hear me? Ma'am, can you hear me? Getting no response to verbal. I'm going to try painful stimulation. Am I getting any response?
Your patient is unresponsive.
Okay. My patient's apparent chief complaint or life threat is that she's unresponsive and multi-systems trauma. Okay. Next thing I'm going to do is go ahead and assess my patient's airway. If you can do a jaw thrust for me. And is my
airway is patent.
Okay. I'm going to go ahead and attempt to insert an oral airway. Does my patient accept it?
She accepts it. There is no gag reflex.
Okay. My next step then is going to be to assess my patient's breathing. What am I seeing right now? Is she breathing?
Yes, she's breathing with some difficulty.
Okay. Can you tell me the rate and quality of her breath, please?
It's very rapid in the area of around 28 per minute.
Okay. I'm going to assist my EMT partner to ventilate my patient once every 5 to 6 seconds with a BVM at 15 liters per minute. I'm also going to expose my patient's chest to find out if there's any injuries that are contributing to her difficulty breathing. I see some bruising here on her right side. What else am I seeing?
Well, she's in obvious respiratory distress, as I noted earlier. Her right mid-chest bruising is present. You also see paradoxical chest movement.
Okay, paradoxical chest movement is indicative of flail chest. I'm going to go ahead and place a bulky dressing with some counter pressure on that right side of her chest. I'm also going to auscultate her lung sounds, checking all four sides, and what am I hearing?
As you auscultate breath sounds bilaterally, you'll have decreased breath sounds on her right side.
Okay, decreased on the right side. All right, so I've managed her breathing, airways in place, oxygen's in place. We've managed the wound as best we can. I'm going to go ahead and cover her back up as best I can right now. I'm going to move on to circulation. Does she have pulses present?
Yes, she does. She has good radial pulse and carotid pulse.
Okay. Are there any major bleeds that I'm seeing right now?
There are no major bleeds.
Okay. What is her skin color, temperature, and condition?
Her skin color is cool, pale, some cyanosis in the lips.
Okay. At this point, I'll treat her for shock as best we can, keep her warm. I'm not going to position her at this time. My patient is a priority transport. After we've made our transport decision, I'm going to instruct my second EMT partner to obtain a full set of vitals for me. I'm also going to try to obtain a sample history. Is there someone that can give me information on this patient, or am I finding any information on my patient?
There was no one available to give you a sample history. Your partner does come back, though, with the following vital signs. Her blood pressure is 72/60. Her pulse is 138. Her respirations are 28, and she's being bagged.
All right. I'm going to go ahead and start with my head to toe. I'm going to start at her head, and I'm going to start with checking her body for decap BTLS. I'm looking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling. Basically, I'm looking for anything that's not normal.
You see some superficial abrasions to the head and face.
Okay. And I'm just checking the head for anything. I see the abrasions to the face. Are my ears clear?
Your ears are clear. There's no fluid or blood.
Okay. Are my patient's eyes clear and equal and reactive?
Her pupils are equal but sluggish.
Okay. Is her nose clear?
Yes.
And the mouth was already clear. We've determined that. Does she have midline trachea?
Trachea is midline.
Okay. Any jugular venous distension?
There's no jugular vein distension.
Okay. I'm going to reach around behind. Do I feel any step-offs in her C-spine?
There are no step-offs.
Okay. I'm going to go ahead and check her collarbone area for stability. Is that stable?
Yes, it is.
All right. At this time, I'll have my other partner go ahead and get a C-collar on the patient. I'm going to go back to the chest area here and just reassess the chest. I want to make sure that her sternum is intact and stable.
The sternum is intact and stable.
Okay, I'm going to go ahead and check for the stability on the rib cage here. Am I finding anything other than the right side?
The left side seems to be intact.
Okay. I'm going to go ahead and listen for oscillate for lung sounds again. Do I have any changes from previous?
No.
Okay. Moving down to the abdomen, I'm going to check all four quadrants, starting with the upper left.
Soft, non-tender.
Okay. Lower left.
Soft, non-tender.
Okay. Upper right.
Soft, non-tender.
Lower right.
Soft, non-tender.
Okay. Go ahead and check the pelvis for stability. I'm going to be pressing in.
Pelvis is stable.
Okay. I'm going to check the genitalia, perineum area. Is there any incontinence or bleeding in the area?
No, there is not.
Okay. I'm going to go ahead and start at the legs. I'm going to open them up. I'm going to go ahead and start at the top and work my way down.
No deformities, unremarkable.
Okay. I am finding a deformity to the right ankle area. I'm going to go ahead and check for CMS.
Okay. You have a weak pulse.
Okay. And do I have any purposeful movement or sensation for my patient at all?
No, the patient does not respond to sensation, and there is no purposeful movement in this extremity.
Okay. I'm going to go ahead and cover this up right now. I'm going to move over to the other side, check the other leg. Starting at the top, work my way from the femur down to the knee.
Unremarkable.
Okay. Check CMS on this extremity. Is it present?
Yes. It's a weak pulse.
Okay. And no purposeful movement?
No purposeful movement. The patient does not respond to sensation.
Okay. Go ahead and cover up as best we can. I'm going to come back up to the arm here. Starting down at the shoulder, working my way down. Am I finding any deformities or any notable injuries?
No. Patient's left arm is unremarkable.
Okay.
She has a weak radial pulse.
Weak radial pulse and still no purposeful movement?
No purposeful movement. The patient does not respond to sensation.
Okay. I'm going to move around to the other side here and go ahead and check her right arm. Okay.
The right arm is unremarkable.
Okay. CMS, do we have pulses present on the right arm?
Her pulse is weak.
And still no purposeful movement.
No purposeful movement, and the patient does not respond to sensation.
Okay. I'm going to go ahead and go to the other side of my patient. And what we're going to do here is we'll go ahead and roll our patient and get her on a backboard. So we'll roll her, roll the patient. I'm going to go ahead and check the posterior from the back. Do I find any injuries, any step-offs, any blood, any swelling?
No, patient's backside is unremarkable.
Okay, we're going to go ahead and place the patient down. Once we get her backboarded, we're going to manage any secondary injuries. The one that we found right now is we're going to go ahead and address her right ankle. I'm also going to continue to reassess my patient once every 5 minutes to note any changes or any improvements. She is a priority transport. We're currently treating her for shock. I would ask for that second set of vitals right now.
Okay, your second set of vitals is a blood pressure of 92/74. Her pulse is now 118. Her rate of respiration is 22.
Okay, we have some improvement. Our patient is packaged, ready for transport, and I am done with the station.
Thank you.